Good afternoon, everyone. Thank you for joining us. I'm Andrea Bonacci with Adirondack Health Institute, and welcome to the third day and final session today of the 2022 North Country Leadership Summit, Optimizing Healthcare, Community Collaboration, and Workforce Resiliency. We'd like to thank all of our sponsors who helped to make this event possible. We appreciate your continued support. And just a few housekeeping items. We are asking that participants place all questions and comments in the chat. Staff will be monitoring questions to ensure that they are answered during the Q&A portion of the session. All attendees are to remain muted with videos off for the presentation to support broadband connectivity. And all presentations will be recorded and archived on the North Country Leadership Summit webpage that will be available within the next couple of weeks. And now I would like to introduce our next presenter, Shane Ash from St. Joseph's Addiction Treatment and Recovery Center. And Shane, you can go ahead and share your screen and you can get started.
Thank you so much. It's a really great gift to be with you. Let me focus on hitting the right buttons here. We're here today to talk about caring for caregivers and responding together to the burnout crisis among our healthcare workforce. I know that if you have shown up today for this conversation, that you are well aware of the issues at hand and are probably already practicing and taking steps to address that within your organization and or for yourself. It's a great gift to be here to represent not only St. Joe's, but also a new program that we're developing out called Adirondack Retreats. We'll talk about that and how that you might participate, and we could participate together in that and caring for your caregivers towards the end of our presentation. Today, I'm actually presenting from the second week of 3 weeks in a row of retreats, therapeutic retreats we're offering to peer support specialists across New York. The last 2 weeks, we've hosted 24 peer support specialists, and we look forward to another week of retreats next week, and to the summary of the outcomes and the feedback from these who have participated and how that it has been truly transformative, not just here in retreat, but how that then affects in their workplace and beyond. Let's get started today by just quickly reviewing the pathway that's ahead of us in this presentation. We're going to talk briefly about a standardized definition of burnout. Of course, that's necessary in order to help capsulate research and to look at that and to respond to that. We're going to look a little bit at why it's happening, some of the social realities, social determinants that have led to burnout. We're going to look at the evidence-based responses and what the research is telling us and how that we can respond both as caregivers, organizations, and as individuals who are experiencing the symptoms and effects of burnout, compassion fatigue, and vicarious trauma. And then we're going to look at how we might be able to work together, Adirondack Retreats and your particular agency or you, and how we can respond across with good care to all of the caregivers in New York. And we're going to then kind of just pause together. I wish desperately we could see each other on the screen and that we were circled up, as I have gotten to do with so many over the last couple of weeks, and we could tell stories and share stories. But I'm going to invite us together today to just kind of look inside of ourselves and offer care for one another. And then we'll have a time of question and response at the end and really look at the practice of how we can respond. That definition of burnout, that is a standardized definition that the research is primarily building itself around, is offered to us by Maslach and Leitner and their work that started back in the late 90s, early 2000s, as they began to look at burnout among healthcare workers. That definition that seems to kind of always find itself into the research reads this: burnout is the combination And that's a big key, the combination of emotional exhaustion, depersonalization that creeps up as a cynicism towards the work, and a low sense or a sense of low personal accomplishment that then leads to decreased effectiveness. If this is the standardized definition we're working with, we see that burnout is at work among us, and it is affecting broadly not just our organizations, but local communities and meaning and purpose within lives of people who have served in the healthcare industry, many for their entire lifetime, their work lifetime. But rather than just focusing on this kind of formal, standardized definition, I want to invite us to enter the chat together. And I want us to put words on how that we might define the burnout experience. I am very certain that each one of us can quickly put some words together that says, here's where I'm at. How might you describe what they describe as the emotional exhaustion? How might you put words to the depersonalization, cynicism, that sense of low accomplishment? I'd like us to add our particular story and the best we can with the chat today. And I think somebody's going to help us read some of those comments out and let your voice be represented as a definition. What's your experience? How has burnout reached you? I'm going to pause and let us enter the chat.
So I'm seeing overwhelmed is a comment that just came through.
Yes, overwhelmed. Ooh, yes, I see that one too.
Frustrating, not effective is another comment. And then insomnia because my brain has trouble disengaging from stressors and being, sorry, scrolling down, being overwhelmed, lack of energy, defeated, feeling stuck, unable to move forward, definitely trouble with sleep due to high cortisol levels, feeling drained, loss of focus, unmotivated, apathetic.
Words that just show up in the chat box. We've thrown into the air today. Thank you for reading those. Thank you for offering them. For me, as I get a chance to sit in front of people who have used very similar words, if not the exact words, and then get to listen to the stories that have led to those emotions, those feelings, those realities, I'm aware that the stories that have got us here are filled with suffering and pain, and also filled with strength and resiliency, determination. I just want to pause and say that those words quickly typed out, that identified feeling, I want to say I hear that, I see that your experience is valued and recognized. I'm grateful that you took time to say and to present where you are and how that burnout has reached you. I want to remind each of us today with this gentle reminder that regardless of what organization you work for, what agency, what work you do, direct care, administration work, whether or not it's in a dietary role, whether or not it's a counseling role, whether or not it's a nurse, a physician, that your person, that you are the treatment and the care that your organization provides. It's an old cliche, but the truth is very, very real. Organizations, agencies can't care or treat. People care and treat. Your well-being, your personal well-being matters to the quality of care that is at work. Of course, we know this to be true. Each one of us do in our experience, but bringing that into the reality of our organizations and bringing that into the reality of how we then go about seeing one another, responding to one another, caring for one another, making sure that we're operating out of the overflow or a full cup, if you want, rather than out of scarcity, that we're operating out of well-being and health and agency rather than exhaustion and frustration and numbness. This is crucial. Care and treatment will suffer tremendously, is suffering, unless we can begin to get kind of our imagination and our practice wrapped around how to care for the well-being of one another. Well, we already know what's happening by our own experience, but let's look a little bit more broadly at that. Even before 2019, COVID-19 pandemic, there was already research being done by the National Academy of Medicine that was looking at vicarious trauma, burnout, compassion fatigue, and recognizing that it was already at a crisis level before we reached the pandemic. 35 to 40% of nurses and physicians, 45 to 60% of medical students were already reporting burnout symptoms. This is shocking, but the burnout-related turnover nationally is estimated at $12 billion for nurses and physicians, and that amount does not account for other types of health workers, does not account for mental health or addiction treatment providers. The cost of burnout is at crisis stage, and somehow we must respond. Those consequences, those personal consequences upon the caregiver themselves, directly impact, as we know, health workers to patients, the entire healthcare system, and local communities. Let's just look at the realities of some of those social determinants that have made that a reality. There are many, many on this list. I've named only a few, just the beginning of things. But we know that healthcare workers are inextricably impacted by the broader social realities. That just because we show up to work and put on the badge or put on the uniform doesn't remove us from the social realities that are at work around us. Most of the time, it magnifies it. It brings it into greater focus rather than lessening it. Obviously, COVID-19 was a big impact on burnout. Then we have things like the political weaponizing of fear. It's a reality that we don't know who we're standing on, if it's left or right or whatever. There's always this question mark of who it is and are we safe? And is this a safe person? There's a generational shift that's happening right now culturally about meaning making and identity and what that means and how that fits within our work life. That cultural change that's happening, there's a shift that's shaking up our culture regarding philosophy of work and economic values, that there are personal costs being measured, that people are beginning to not just see a paycheck as does this equal the work and does this but also saying my energy, does this effort affect my energy? How is that affecting my life? So there is a philosophy shift that's happening. And then there's also a parallel happening of moral distress and injury, that as when we enter the room of care, that there's a great distress that leads then to injury that we take home with us that's affecting the personal well-being. This is just the beginning of the social determinants that are shaping the crisis that's happening among us, and much more time should be spent in acknowledging those things that are at work. But let's look quickly at what we might do. What are the evidence-based responses? How might we begin to address, to hold space for this crisis that's at work? I'm particularly influenced by research of Stefan de Hurt. He looks at the personal kind of well-being practices that we could engage. He summarizes those personal wellness strategies in this way, 5 of them. He puts at the top of his list that there should be a particular strategy in our personal wellness approaches on relationships, connection, the formation of community of common stories. And this is referring to the basics of spending time, quality time with friends and in relationships, significant others. And this strategy of focusing on relationships, it includes the idea of developing new connections with colleagues beyond just even the workplace, but expanding that connection with colleagues and their experiences in other places, so as to know that there's a shared common story and a shared emotional, existential aspects of the work that we do, that it's not just me. Those relationships and those connections, both personally, professionally, help lead to personal wellness strategy that deals with or lessens the symptoms of burnout. A second element he talks about are spiritual practices, that it's been reported up to 34% of persons who engage, who say that this is a really important piece of my wellness, is my ongoing spiritual practices. And for each person, those spiritual practices take a different hue, a different color, a different shape, but they credit spirituality and spiritual practices as part of their personal wellness. Another one is pausing to actually evaluate our work attitudes rather than just staying kind of stuck there, having a way to process, to evaluate those attitudes, to be aware of them and how they're affecting us. Another of his strategies is the self-care practices, being able to have the hobbies and the self-care and being able to focus on that agency of the self to make sure that we're caring for that as a priority. In other words, we are filling the cup rather than emptying it out and living our life and working out of scarcity. We are living out of the overflow. So these are a few of the, and adapting a life philosophy. I forget this, but the fifth is having this life philosophy that balances work and play and family and relationships, and being able to articulate that and know that is a particular strategy that helps us build, reduce the symptoms of burnout. Another one of the popular kind of go-to Ms. Majlak's research on how we might, as organizations or agencies, address burnout. Maslak talks about the 3 C's. The first being to learn how to collaborate between the agency and the worker. This collaboration means that we're seeking to engage active ideas and feedback, listening to alternative approaches, addressing needs. Things like looking and seeing how that charting and that notation creates a high level of stress and what that looks like and how we might ease that burden within staff. Looking at very practical ways, listening to the issues, and then as an agency serving that staff to say, we hear you and we respond to that. The second is this customization, that agencies must be willing and ready to recognize that there's not a one-size-fits-all kind of model to address burnout, but we must be adaptable. It can't be that we just stay to our old EAP programs or rely on HR to do it, but we must have multiple strategies and avenues to address and respond and hear those who are suffering. And then the last is we got to commit as agencies, as providers, as organizations. We've got to move, as the old country song, beyond talk and have a lot more action. We have to commit to burnout, compassion fatigue, vicarious trauma as being active threats to our workplaces, to our communities, and to our staff. And we must have a plan in place. There must be something. And we hold it so that we can collaborate and we can customize and we can commit. And being able to recognize that that is a fluid motion is important. Perhaps you're aware of it, but Dr. Murthy, our U.S. Surgeon General, recently released a report that is worth time and reading. I want to just play a quick 2-minute video of a few of his words.
From the moment we come into this world to the times throughout our lives when we are hurt or sick or need help, health workers are there for us. They are the core of our healthcare system. It's hard to imagine where we'd be without them. But the truth is, they are now struggling with burnout to the point of crisis. Even before the COVID-19 pandemic, health workers faced major challenges. 54% of doctors and nurses were already experiencing burnout. With the pandemic, things have gotten worse. Health workers have sacrificed so much during these last few years, sometimes even their own lives. More than 50% of public health workers have reported symptoms of at least one mental health condition, such as depression and anxiety. 8 of 10 health workers have experienced workplace violence, and 66% of nurses have considered resigning. Health workers are leaving their jobs in large numbers. We're looking at a future without enough doctors, nurses, and other critical health workers. That puts our entire healthcare system at risk, and it makes it harder for patients to get care when they need it, not just for COVID, but for all our health needs. We must take action. Join me in calling for the urgent changes our health workers need to thrive. Healthcare systems, health insurance companies, and government must prioritize health worker well-being. This means increasing access to mental health services, reducing workplace burdens to prioritize time with patients, and protecting the health and safety of all health workers. We can all help by being kind to our health workers, recognizing the stress that they're under, and by taking care of our health to the best of our ability. Together, let's prioritize the well-being of health workers. It's time for us to take care of those who have always been there for us.
I would suggest, if you haven't already, to just Google that, Surgeon General's advisory addressing healthcare workers
From the moment we come into this world,
on repeat, and go there and spend some time studying both the research presented in that advisory and the outcomes of what of our approaches and what they can be and should be. A few of those approaches that are listed in Dr. Murthy's paper about what healthcare organizations can do are the following. They strongly encourage that organizations build this commitment that we're talking about today to the health and safety of healthcare workers into the very fabric of the organization, that it be part of our language, it be part of our culture, it be part of our awareness, that it not be a stigma or it be attached to shame or it be looked at as some sort of weakness, but it be something that we are aware of as an active threat, an active part of the work that's in front of us. They encourage us to review and revise our policies to ensure that none of our healthcare workers are deterred from seeking appropriate care for mental health, physical health, substance use challenges, that it be a regular part of our supervision, of our evaluation, and of our commitment to our workers. And then really work to increase connection, increase access to high quality, confidential mental health and substance use care for all healthcare workers. This is partly what motivates us at Adirondack Retreats to offer a very high quality mental health and a substance use aware program that can be in partnership with your HR or EAP or you as individuals or your organization to say that you have a tool, you have another resource that is here to treat specifically burnout, compassion, fatigue, and vicarious trauma. And this part that is highly recommended is to build community or rebuild it, build these social connections, build bridges, not just within your own staff, but across agencies, across providers, so that there's this commonality of experience that begins to mitigate burnout and the feelings of loneliness and isolation. What we've discovered even today, as I sat in a circle this morning in retreat with 6 different agencies that are represented here with the 14 people that are here today on retreat, and all of a sudden it was, oh, you, oh yes, us. And in that common shared suffering experience, there's all of a sudden an inclusion of that and a beginning to integrate and moving from a stuckness of a trauma state to being able to integrate that into their experience in a building of resiliency. Building community and social connections among workers is crucial to addressing this burnout. And then really begin to have some preventative measures, combat the bias, combat the racism, the discrimination that is present in the workplace, that is a burden too heavy to carry for many of our staff and workers. And then invest invest in communal health prevention, invest in these kinds of opportunities that are there to serve your staff, and social services that will help address health inequities. Look quickly at what the recommendations of Dr. Murthy are about what health workers can do. We can begin to help build culture, learn to recognize the signs of burnout, of compassion fatigue, distress, learn to pay attention to mental health challenges, be aware of it, notice it in one another and in yourself. We can begin to then connect and reach out, acknowledge it. We can begin to prioritize moments of connection, of joy, recognize that those things are intentional practices that must be engaged to combat the symptoms of stress and burnout. And we can also then practice preventative measures, get back to the basics of making time for ourselves and practicing good health habits. And then we can begin to speak to your agency, speak to your HR team, speak with your supervisors, begin to use your voice to advocate for positive change in the workplace. This empowerment and taking agency is a large part, actually, of reducing the symptoms of burnout. Recognize that as you speak up for the behalf of others, you're also speaking up for yourself and the community around you. I want to just look at what we do at Adirondack Retreats. We're one of a handful of initiatives that are trying to respond to burnout, compassion fatigue, and vicarious trauma in a caring way for caregivers. We at Adirondack Retreats offer kind of two ways to engage. The first is customized 3 to 5 day retreats for your organization or team. The retreats we are having currently right now invited across a particular modality of care, so peer support specialists within the addiction treatment field. And so they've come from different agencies, but the same practice and finding commonality in their stories in a 5-day retreat here on Upper Saranac Lake in Saranac Lake, New York, and the Adirondacks. But we are willing to sit down with your team, contact us. We will build a customized retreat for your particular people or for a particular modality that you are interested in. We can schedule those as seasonal retreats as well with particular wilderness activities. In other words, when it's wintertime, which is 7 months of the year for us here, we can do retreats that capitalize on experiencing some of those winter activities. That could be that the retreat is built around a warm fireplace in a cozy camp someplace, or it could be an activity like cross-country skiing. All of the things that the Adirondacks have to offer, we will build both activities and seasonal year-round retreats that can utilize the beautiful nature of our area as part of the healing modality. We utilize an approach that is highly relational and centered on compassion, compassionate presence, connection, and continued care. Each one of our retreat participants, after an experience of a 3 to 5 day retreat, are then also invited to 1 year of continued connection as a group. We use a virtual connection, but then also some regatherings, if it's possible, to connect people together and build those relationships. And it is the relationships, as the research tells us, and those common connections and stories that help build the resiliency to reduce burnout. We have an extremely qualified and certified staff that their heart is invested in this work of caring for caregivers. And in these retreats, we focus on the somatic experiencing aspect also of the nature and beauty that are with us. I wish I could pan my camera around for a bit and today to see the sunshine and the Upper Saranac Lake that we are on today, and this great camp, Adirondack Great Camp, that we are utilizing for these retreats. It's a beautiful place, and beauty heals. A second approach that we will offer is our individual retreats. We can work with HR or organizations or just direct to individuals. And we offer 4-day intensives that you would come in. You would have a 4-day intensive experience with our full team. You'd maybe be in a house with 1 or 2 others that are also having individual intensive, but you would be specifically persons who have some vicarious trauma. We would be very trauma-informed environment, and we'd be working to help process that and bring some healing into those experiences. That trauma-informed environment is hosted by our certified staff. We have certified EMDR specialists, we have spiritual direction, narrative therapy, internal family systems therapy, compassion fatigue practitioners, we have trauma practitioners, we have wilderness therapy practitioners, certified yoga and Reiki practitioners. That list could go on, but I ran out of space on my slide. We have a extremely qualified and local staff to be able to help treat as a customized experience as the needs arise. We also will do in that individual intensive guided wilderness experiences. 3 weeks ago, we were able to take a guided hike with 2 of our practitioners and 1 person and climbed Ampersand Mountain together. Just that experience, that one-day experience, was transformative to kind of take a break away, process with some steps and climbing, and begin to refocus and build resiliency for that person. We also offer with our individual intensives not only just the experience itself, but that also, like our retreats, includes a 1 year of continued ongoing care. So monthly or weekly check-ins, direct phone number to where there could be a relational connection with our retreat guides and hosts, so that there's a support system for those who desire that. So these are part of our strategies and part of our program that we're developing and utilizing to help care for those. Why should we work together? Why Adirondack Retreats and your agency? Well, first of all, this is our passion. We care, and it's also our expertise. This is something that since COVID-19 that we have done. We began at St. Joe's, recognizing that our particular staff, our 265 employees, needed a voice of care as they entered into this pandemic. We took a long view, recognizing that this was going to be hard and difficult work. We began to offer daytime retreats with our staff to care for them. That has expanded over the past 2.5 years to our most recent partnership, actually, with the RCORP grant of AHI and their effort to reach out and allow us to host peer support specialists and healthcare workers, direct care workers over this last couple of weeks. This is our expertise, and we want to join you and help you care for your staff. The current research all points to mental health and wellness programs committing to that being a key to maintaining employee engagement. You need to have a direct plan of action, and we can help be part of that plan to help engage and work alongside and provide ongoing care and support for your staff. Also, we're heavily invested in the assessment process and providing outcome data. And as we go through this next year and the year after that, being able to look at our own practices, evaluate and customize them, and make sure that we have the evidence and the outcome data that demonstrates exactly what we're claiming to be. And we are utilizing assessments. We're using pre and post and follow-up after a year. And that data is coming directly from your staff and from your agency people who are able to feedback, and we will provide that data back to you as well. And then direct partnership. We're going to work with you and for you. You say, here's our needs, here's what we have, and we will customize that and work alongside of you. We are an extension of care that you are offering. And then also that continued care provides a relational parallel process that goes alongside of what you're doing. And we're also cost savings. I want to make sure that we're aware that part of the world we're living in today, we know is difficult financially for many, many organizations. And none of us, I think, are exempt from that today. Our costs are intentionally low in comparison to other like opportunities. This is due to our connection within St. Joe's Continuum of Care and their generosity to say, we believe in this, let's expand this and offer this to others. And then also our ongoing pursuit and current partnerships with donors, private donors, and then grant partnerships. And so we are a good alternative and your cost savings for you. We can also provide CE credits for retreat participants. And so part of our plan moving forward is to be able to provide continuing education as well. And let's just pause and recognize that the retention of only one health worker in your system offsets the cost of more than 12 participants in a retreat. It is an investment that's worthwhile for you. Not that we ever look at our staff as just the dollars, but it is an investment with a return that is well worth it. Just pause. This is actually where we are today. This is a night shot that somebody took. Imagine the evening there in the boathouse on Upper Saranac, connecting yourself to something beyond yourself. Actually, you can't really see it, but on that deck right there beside that house, there's a hot tub. And last night, the hot tub was the place of gathering, a place of laughter as I looked over the boat dock and a group of people who are finishing their third day that are unrecognizable right now. Their stories have shifted and changed. Their pain has turned to remembrance of joy. That experience and those experiences will return back with them. We would love to host you, members of your agency, to begin to care for you and offer that kind of experience for you as well. I want to make sure that I offer sources today. Boy, I have very little without those who are helping point me and point us in the right direction. And so among those sources I want to highlight is the Dr. Murthy's Surgeon General letter that he put out back in May. And I really want to point you to reading through that and utilizing some of those resources that are listed inside of that. I want to pause here now and just take questions and response. This is not question and answer. Not a lot of answers, but I can help respond. So I'd love to pause and take questions and response.
Thank you, Shane. We'll open it up now to Q&A. If you have questions, please feel free to unmute yourselves and ask, or put your questions directly into the chat and we'll be monitoring. Shane, if you'd, I know that you've got your email up there. So if everyone wants to just refer, Shane has his email up in the last slide here. So if you think of any questions or want to collaborate after the presentation today, you can feel free to reach out to him. I do see that we have a question that just came through. What are some of the activities you do at the retreat?
Absolutely. Well, beyond the wilderness activities that we offer, which are really some of the basics of what we do, we'll do hiking. This is actually a picture from a recent hike on Upper Sand Mountain. We have kayaking, water activities. We also have some therapeutic experiences where we hear and share one another's stories, and we act as holding space and witnessing with each other. We do some training around the idea of compassionate presence. And so we go back to the basics of being caregivers and talk about the skills of compassionate presence, renewing that heart of compassion for people as they engage their work. We know that that builds resiliency in the work as well. We also emphasize rest. We emphasize sleep. We emphasize healthy eating. Our chef customized meals to each person, and we emphasize that routine as well, a schedule. And we laugh together tonight. It's going to be fun. One of our closing pieces is we're dancing together. Last week it was a salsa lesson, which was a lot of fun, but we get the bodies moving and we engage. Tonight is square dancing. I'm a little nervous about it, but we'll see how it goes. It's going to be a lot of fun. But the whole process is built as a retreat. We build around thinking about the 5 dimensions. The physical self and healthy practices in that regard, the spiritual self, the emotional health, relational health, and mental health. And so those 5 dimensions we engage, and each person, when they come in the morning, they build a plan for their day, that we have certain activities and certain things through the day, but it's each person that engages the activities that they want to choose, they want to participate in throughout the day. And so we help engage and open up opportunities for them to practice their agency and what they want to do. I'd be happy, by the way, to respond to those questions more directly and build a retreat around activities that would be meaningful to your group or yourself. Yes, and please reach out via email, or if you go to AdirondackRetreats.org, there's a contact page there as well. Send me a note, let's start a conversation. And boy, I'm really, really thankful that you were interested in this topic and responding in some way to caring for caregivers. Thank each one of you.
Are there any other questions that anyone would like to ask, or any comments? We just had another question come through. How diverse are the groups?
Yeah, very good question. This particular week, I love the diversity of our group, specifically with modes of care, where they've come from, and then personal diversity as well. And I think anybody with a heart of diversity and awareness would look at the group of 14 we have today and be very, very pleased. And I'm thankful for that. Additionally to not just the groups, but we're making a commitment to diversity and inclusion within our staff as well. And that's an important priority for us. Next week, we will have both physicians and 2 dietary workers in the same group. So just an interesting mode diversity that will be in the same group.
Thank you, Shane. Any other questions that we have? Again, you can feel free to unmute yourself as well and have more of an open dialogue. Okay, well, I think we'll wrap up for today then. Again, Shane's contact information is available on the slide deck right now. This recording will be available and archived on the AHI website. Shane, thank you very much for this presentation. We appreciate your time today. This was really great, and thank you for everyone who participated, and we look forward to seeing you tomorrow for another day of presentations. Thank you, everyone.